Today I'm going to be talking about Canada's healthcare system and what I would do to change it to better Canada. Healthcare is important because it gives access to universal healthcare coverage. It reduces out-of-pocket expenses for individuals and families, and it addresses social inequity. The primary objective of Canadian healthcare policy is to protect, promote, and restore the physical and mental well-being of residents in Canada and to facilitate reasonable access to health services without financial or other barriers. Good health is a major resource for social, economic, and personal development, and it is an important dimension of quality of life. Healthy, productive citizens reduce the burden of healthcare system and contribute to a strong economy. Some changes that could be made to improve the healthcare system are expanding access to family health services, including in rural and remote areas, improving access to quality mental health and substance use services, modernizing the healthcare system with standardized health data and digital tools, and reducing wait times at urgent care facilities. For these outcomes to be met, the Canadian government announced that an investment of $196.1 billion over 10 years, including $46.2 billion in new funding for provinces and territories to improve healthcare services for Canadians. This is funding that will be distributed partly through the Canada Health Transfer and partly through tailor-made bilateral agreements with provinces and territories that allow for flexibility jurisdictional healthcare systems needs. In addition, it will invest $2.5 billion over 10 years to support Indigenous priorities and complementary federal support for a total of $198.6 billion over 10 years. These investments are on top of the already significant funding will further help provide Canadians with the health care that includes the topics that I brought up at the start. The Canada Health Transfer is the largest major federal transfer to the provinces and territories since 2004-2005. Through cash and tax point transfers, the federal government has supported on average 32% of the provincial and territorial health expenditures. The government is proposing to provide the further support through CHT as follows: an immediate unconditional $2 billion CHT top-up to address immediate pressures on the healthcare system, especially in pediatric hospitals, emergency rooms, and surgical and diagnostic backlogs. Since the pandemic, mental health has been a huge crisis in Canada. The Government of Canada provided $45 million over 2 years to the Health Canada, the Public Health Agency of Canada, and the Canadian Institutes of Health Research to develop a national mental health services standards in collaboration with the provinces and territories and other key partners. The Canadian government is now working to modernize the healthcare system. Canada recognizes the importance of a strong and capable healthcare workforce. Efforts include recruiting internationally educated healthcare professionals, reducing administrative burdens for providers, improving labor mobility across provinces, and prioritizing health and wellness for the workplace. The 2023 federal budget allocated $200 billion to support the Working Together to Improve Healthcare for Canadians plan. This collaborative effort focuses on shared priorities by expanding access to family health services, especially in the rural and remote areas. And since the pandemic, it highlighted that the need for a resilient healthcare system. Healthcare Canada advocates initiative solutions for research-informed best practices and addressing ongoing workforce challenges to create nimble, sustainable, and equitable healthcare system. Canada is actively investing in its healthcare workforce, addressing key priorities, and embracing digital transformation to enhance its healthcare system. Canada faces significant challenges in reducing wait times for medical treatment. According to the Fraser Institute's 22 report, specialist physicians report a median waiting of 27.4 weeks between a referral from a general practitioner and a receipt of treatment, longer than the wait time of 25.6 weeks reported in 2021. This year's wait time is the longest recorded in the survey's history and is 195% longer than in 1993 when it was just 9.3 weeks. Variation by province. The total waiting times varies across provinces. Ontario reports the shortest total wait of 20.3 weeks, while Prince Edward Island reports the longest at 64.7. The specialties patients wait longer between a GP referral, general practitioner, and neurosurgical procedures, which is 58.9 weeks, while those waiting for radiation treatments begin treatment in 3.9. It's estimated across the 10 provinces that the total number of procedures for which people are waiting in 2022 is a little over 1.2 million. This means that approximately 3.2% of Canadians are waiting for treatment. While there's no single solution, addressing the wait times requires a multifaceted approach, including increased funding, improved resource allocation, and better coordination among healthcare providers. However, progress remains a complex challenge and ongoing efforts are necessary to enhance access to timely medical care in Canada. One of my personal connections to the issue in Canada is the emergency care wait times. When I broke my leg 2 years ago in August, I waited 6 hours in the Regina General Hospital emergency room before getting into her room. Then I waited a few more hours before I even seen a doctor, just for them to tell me that it was broken. The Canadian government needs to allocate more money to the healthcare system because it is overwhelmed without the amount of practitioners that we need. This ends Carson Say's podcast on healthcare.